A new bill was introduced in Ohio that will require cardiac screenings for student athletes. In our latest edition of Beyond the Game, Brittany Bissell spoke to one of the bill's sponsors. Hey, Britt.
Yeah, Corey, sudden cardiac arrest is the leading cause of death in young athletes in the United States. Now, with that said, I spoke to several people who conveyed just how important this bill is to protect those student athletes. A new bipartisan bill recently introduced in the Ohio House. The bill would require student athletes to have cardiac screenings before a sports season. Dr. Peter Bandicapelli says he's an advocate for the bill.
What we're looking for and screening for are the worst offenders. Some of these defects in the heart could lead to somebody having a sudden cardiac arrest, which might require CPR or defibrillation. And so those are the patients we really want to find before the event occurs to try to help save them.
State Representative Tristan Rader is one of the bill's sponsors.
There's a resident who lives on my street who was a college athlete, and later on in life he was diagnosed with a rare heart condition that he could have really ended up taking his life during his collegiate career. Having known this in advance, he probably would have made some different choices in college. Now, he was lucky that this heart defect didn't affect his life in some negative way, but we know that sudden cardiac arrest is the leading cause of death amongst youth who are in sports. So I thought that it's prudent that we button up Ohio state law and make sure that really smart, modern, best practice cardiac monitoring is included before a student takes the field.
Under the bill, student athletes would complete a checklist that identifies symptoms of a cardiac condition. Healthcare providers who perform those examinations would be required to complete a childhood cardiac screening professional development module every 4 years.
What we're trying to accomplish here is create a standardized system across the state that's going to make sure that every student, regardless of zip code, regardless of where they live or their income level or the resources that school has, gets the same testing so that when a student takes the field, they'll know exactly the risks, and their doctors will have a really comprehensive understanding of their health situation, their heart condition. Because at the end of the day, we need to stop these cardiac arrests.